Hey guys, welcome back to my YouTube channel. Today we're going to go over how you can get out of flat back syndrome. So in this video, we're going to go over the movement assessments and their corrections to make sure you get out of flat back syndrome. We'll also cover the assessments from the first part of the series, which you need to watch if you haven't watched it yet. And we're going to cover what is flat back syndrome. So what is flat back syndrome? It just means that the lower back of the lumbar spine has flattened out, and it generally causes problems. It can cause disc herniations, disc degeneration, other kinds of problems that is associated with bending forward like this. So you'll see oftentimes people that have a very flat lumbar spine or they're rounded like this, and that qualifies you as having a flat back syndrome. So to review, the assessments from the first video went over if in the side view you see that very flat lumbar spine, you are at a risk of having flat back syndrome. Second, if you have hyperflexibility like this woman does, you are at a risk for having flat back syndrome. Thirdly, if you see a hinge point in your spine like this, you probably already have had problems with a flat back or rounded over lumbar spine, and you need to make sure that we correct this. So in this video now, we're going to go over the movement assessments and the corrections. So just because you passed all the assessments in the first video doesn't mean you'll pass these assessments. So check it out. The first assessment concerns the hip hinge. We should be able to easily hinge without rounding over. If you see this, that's a big problem, and we need to be able to get a nice easy hip hinge. And the way that we can really check for it is if we put a stick on our low back and we find that we can touch your low back area with the tip of your thumb, we should very easily be able to bend over and not smash my thumb as I bend over. So I'm going to purposely smash my thumb as I bend over, and I'm trying to do that. But you'll see many individuals that when they naturally hip hinge, they're crushing that thumb, or the stick comes off of the head, or you can just simply see that they're rounded over like this. The correction for this assessment, if we see a faulty movement pattern, is to be able to brace those low back muscles. You need to brace those low back muscles because those are the ones that are going to help you the most with this exercise. We're going to go down, and we at least want to be able to hit 60 degrees and practice being able to get down where there's not extra pressure against my thumb, right? So make sure that at first we're not going down all the way if you're feeling the extra pressure. If you can only do this at first, that's great, but you need to be practicing this every day, 2 to 4 sets, 10 to 20 reps. Try to spread it throughout the day, and the more and more that you do this, you're going to get out of that flat back syndrome for this test much faster. Let's get into the second test. The second test is our squat test. Squat test is very similar to the hip hinge test, but it's a little different. We're going to squat down, and we should feel no pressure really against our back right until we start to hit with the thighs just a little above parallel. So if this is parallel, you can see the line through there, and I'm just a little above that, we should be able to very easily reach that without me having to try to keep my spine extended like this. But you're going to see a lot of people at first where they just round over like that. And that puts you at a much higher risk for problems with having a flat back. So the correction for this is, again, we brace our low back muscles and we go down making sure there's no extra pressure against the thumb or where the stick comes off of our head, or even sometimes I've seen off of that back like this. Again, make sure that you work your way down gradually, and then over time, when you can do it easily with very little effort, you know that you do not need to do this anymore. But for some of you, it's going to take weeks. For many of you, it's going to take months, and maybe even all the way up to a year to really get that good stiffness, which we're going to talk about a little bit later in this video, up to par so you can demolish these assessments. Our third test is we're going to have our hands behind our back, and I want your middle fingers to touch behind that low back. We're going to bring our legs up, and you shouldn't feel any extra pressure maybe until we get our legs vertical. But if you feel pressure and you feel your hands being smashed right here, then your back is rounding or flattening out faster than it should be. So the problem with flat back syndrome is often that it's not the alignment. A lot of you passed all the tests in that first video, but not all of you are going to pass these tests because you realize your back is flattening out as soon as you're lifting up, and that's a problem. So if you find that your back starts to flatten out before you reach this point, then we're going to try to stay extended, use brace, tighten up your low back muscles, raise up, and maintain that good posture. And this is what we're going for here, maintaining that good posture. And after a while, after with practice, probably for many weeks, for some of you many months, this will become easier and it will become easy. That's when you know you're done and you're not at risk for this particular test. So you have to go through all of the tests. So our last assessment concerns a seated test. So our last assessment is going to be our leg straightening test, and we're going to do one leg at a time. So again, we put our fingers together behind our low back, we straighten our leg, and we see if our low back puts pressure, extra pressure against our hands as we straighten our leg. If it does, you have failed this test and you need to correct that, especially if you've had pain from bending over in this direction or in that rounded flat back direction. So make sure that you also try your left leg, because for a lot of people, the right leg versus the left leg is going to be different. And again, we need to be able to very easily straighten and with minimal effort, make sure there's no pressure or very little pressure against our hands. So to practice this, a lot of you may only be able to do here and control that pressure well. But over time, you're gonna be able to straighten that leg and have minimal pressure against your fingers. Pretty much, we're just avoiding that position. And to do that, always brace your low back muscles. So what we're building in these assessments is both strength and stiffness of your low back musculature. These are not just strength corrections, these are stiffness corrections, so that when you bend over, you're getting the support that your low back muscles should provide you. But oftentimes when you're bent over, we're stretching them out constantly and they're not giving you the support that you need. So these exercises teach your body how to support, and they give you enough muscle integrity over time to naturally support you when you don't even think about it. So that's why these corrections, at first some of them are going to be impossible for you to do them correctly or to pass, but over time they will actually become easy and natural for you to do them, so that you don't even really have to try to ensure that you're bracing in the back. That stiffness and the integrity of the muscles will be built up so you can do them quite easily. If you have any questions or comments, let me know. If you got anything out of these videos, please subscribe to my channel, ask me some questions. Thanks for watching.